In today's video, we have done a full face makeover, including Dysport and Restylane on our beautiful model. Be sure to watch the entire series as we take her through a complete skin transformation as well as permanent makeup. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and I've been building my business here at External Affairs Medical Spas for the last almost 25 years. My family started this business many years ago. Our specialty is beauty and regenerative medicine, which means that not only do we want to help people look and feel great on the outside, but we also want to start on the inside and really look at things like hormones and nutrition and all of those things that go together. The purpose of our videos is to educate people better when it comes to these procedures. So many clients have fears, and by producing better content, we're hoping that we can alleviate some of those fears. We really appreciate your feedback, and we want to know what you want to know. So please pop your questions in the comment section below, and we'll make future videos to address your questions. Just get you to drop your chin down a little bit. Great. And then just do a big smile for me. Great, and relax. And I'm gonna do little needle pokes here, okay? Because this is a safe spot for us to go in with a needle. So I'm just gonna turn you a little bit like that. Good, and I'm gonna give you a nice pinch, okay? And we're gonna go in a little poke. And when we're using needles, we always check to make sure that we're not in a vessel. And you're gonna feel a little bit of pressure. And then there's lidocaine in that gel. So as it's going in, it's gonna start numbing the area as well. So I'm just gonna have a peek here just to see how we're doing. And do another little poke here. So I'm just working my way along your bone, just trying to put back what was once there. So I'm just gonna turn you away from me a little bit, and we're gonna do a little poke along your jawline here. So I'm just creating like a little tiny entry point. And then I'm gonna use that cannula that I told you about to get back into this area here. So you're gonna feel a little bit of pressure here. Sometimes you can actually hear the cannula going through your tissue, which can be a little bit creepy for the patient. You okay? Mm-hmm. So you can see I'm right back along the ear here, and I'm gonna try and create a little bit more of a jaw. So I'm just trying to create a little bit of product back by the ear, and that's what pulls the cheek back. Everybody wants the Angelina Jolie jaw now. Okay, so Sherry, I'm gonna be doing your lip now, and I'm gonna make a little tiny poke right in the corner of the mouth. And again, that's my entry site for the cannula. So you might feel a tiny little pinch here. And now I'm gonna be putting the cannula in. Okay, you might feel a little pinch here. I'm gonna get it open slightly. So you can see the cannula is all the way up. And now we're gonna be putting product in the lip. Sometimes when it goes in, if the patient's not frozen, they can feel a tiny bit of a sting. But we're just gently adding some volume to the lip. When we use the cannula to do this, it creates this beautiful, soft lip because it's almost like a tube of product rather than the way we used to do it, which is little boluses of product. So this creates a much softer lip. And I'm just coming in along the vermilion border now. And again, she's pretty comfortable because she's nice and frozen. And now I'm going to change directions and I'm going to get into the bottom lip. So you can see my cannula just slides right along the border of the lip. So we'll fill that vermilion border first. And then I'm going to come back and we're going to get into the belly of the lip. And again, my cannula just slides right in. We need to accentuate the middle of her bottom lip. So I'm actually going to do a little bit more of a bolus there because we need to project that out. And I'm actually going to do a little tiny injection here just to accentuate the Cupid's bow, and she should be pretty frozen for this. Sometimes just that tiny little bit pops the lip up. And I'm just going to turn you to look at me for a second. Good. So we really need to pop out the middle, so I am going to use a little needle poke to do this. So I'm going to do a little entry point down here. So I'm just putting a bolus right in the chin, just to drop your chin down, and I'm using the Restylane Define to do that. And I'm going to be filling in just along your jaw here. And the goal is that we're going to blend kind of the jowl to the chin a little bit better. So when we're filling here, Sherry, we don't want to put too much because we also don't want to masculinize it as well by overfilling this area. We still need to keep it soft. All right, so we're going to do another little poke over here just to make an entry for the cannula. And again, I'm going to get you to open a little bit. Good. Pinch. All right, so we're gonna go on, we're gonna do all the toxins now. How are you doing?
Good.
That's a lot of pokes, isn't it?
That's a lot of pokes.
Alrighty, so we're gonna start with the Dysport, all down here and across here. So I'm gonna get you to do that funny expression for me where you go like this. Good, and relax. So I'm gonna pinch your band and we're gonna do a few little pokes. So with this injection here, Sherry, it's called the Nefertiti lift, after Queen Nefertiti, because she had a gorgeous neck. So the goal again is that we're trying to slim your jawline. Do that again for me, go. Good, and relax. And we're gonna do it again. I'll get you to grab good and relax. So we're gonna hit, it's called the mentalis muscle on each side, and that'll actually help drop that chin down and make you look more oval. Raise your eyebrows up really high for me. Good, and relax. So we had talked about these lines here earlier. I'm gonna put a little bit of Dysport across the forehead, but not very much, okay? Because the goal for you, we wanna get a brow lift.
Okay.
And unfortunately, the muscle that allows you to lift up your eyebrow is the same muscle that causes these lines here. So sometimes it's a catch-22 where you have to have a few lines if you wanna have a brow lift. So we'll soften ever so gently.
Okay.
We just don't want to over soften it. So just a tiny little bit. All right, so we're going to turn you this way. And now I'm going to get you to squeeze tight, like a big cheeky smile, like you're trying to keep sand out. So close your eyes and squeeze. Good, and relax. So that just shows me how your muscle pulls in and down. And then we're going to relax around it. So I'm a little poke in here, and this is going to feel weird. Okay, I'm actually sort of resting right on the bone. I'm going to check and make sure I'm not in a vessel. And then I'm going to put a little bit of product, and this is where you're going to feel some pressure. It just kind of pops it up and it pulls that bone. Okay, so Sherry, we have filled your entire face, okay? We did the Dysport all around your eyes, around your chin, around your jaw. We did filler. We actually decided at the last minute to do filler in her temples. And like I explained to you before that, so you're gonna feel a little bit of pressure in this area, especially as the numbing wears off. Now, with the temple, there's a compartment here. So where we inject it, we pick a safe spot, and then the product kind of diffuses down sort of into this area here, and then that will look better over the next few weeks as well. If that's uncomfortable, you can ice it, okay? We injected your cheeks. I did that with a needle poke. You might have a little bruise back here along your bone, and we'll send you a little ice pack that you can use there. We put filler all the way around your mouth. You might have some swelling overnight. Sometimes when you put filler in the lip, it swells overnight. So if you wake up with bigger lips tomorrow morning, don't panic, okay? We did filler all through here. We did filler in your chin. Your chin is gonna feel really tight, okay? Most women like that because that's what pulls this and really softens those lines. But if it's a bit tender, again, you can ice it for a few days. Okay. And then we also did filler along your jaw, and I don't expect any bruising or anything there. We did the Dysport in this muscle here, and that's gonna take a week or so to kick in. So you should notice that this feels a little bit snugger, okay, in a week or so, and we're gonna have you back and do some more pictures.
Okay,
sounds good. Do you have any questions?
No.
And Sherry, just, how was that experience for you?
It was fine, honestly. There were little pokes and a little bit of grinding, maybe?
Yeah, sometimes you can hear it in your skin, right?
But honestly, it was fine.
Okay.
It was not a big deal.
Well, you're a very lovely model to work on. Thank you.
Thank you.
If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.